Diabetes is a significant health challenge across the globe, and for many people, controlling glucose levels can be a real hurdle. Lately, there's been growing interest in vitamin D, often called the sunshine vitamin. We're exploring its potential to help diabetics better manage their blood sugar levels and improve overall glycemic control. Let's take a closer look at this promising connection. Top 5 findings on vitamin D and glucose control. Number 1. Evidence that vitamin D improves glucose homeostasis. All right, let's start with our first key finding. Recent research is really shedding more light on how vitamin D, that sunshine vitamin we hear about, might assist people with type 2 diabetes in managing their blood sugar. Several well-conducted studies, specifically randomized clinical trials, have actually shown some quite promising results. What these studies found is that when individuals with type 2 diabetes took vitamin D supplements, they often experienced a noticeable decrease in their serum insulin levels. Plus, they also saw improvements in their HbA1c readings. Now, lower insulin levels can be a good sign, indicating reduced insulin resistance, while a better HbA1c shows improved long-term blood sugar control. And as you know, both of these are key goals in diabetes care. This really suggests that vitamin D could be a useful addition to the standard treatments for diabetes. So the next question is, how exactly might vitamin D achieve these benefits? Well, one important way is thought to be through its influence on how our bodies use insulin. You see, our cells have these special docking stations called insulin receptors. Vitamin D may actually help increase the number of these receptors or improve how well they function, possibly by affecting insulin receptor gene expression. And when these receptors work better, our cells can respond more effectively to insulin. This, in turn, allows glucose to move from the blood into the cells where it's used for energy. This improved insulin sensitivity is absolutely crucial for anyone with type 2 diabetes because it helps the body use its own insulin more efficiently to manage blood sugar levels. Moving on, another vital aspect of blood sugar control is how glucose actually gets into our cells. And it seems vitamin D plays a part here too, by influencing glucose transport. Our cells need special transporters to help move glucose across their walls. Vitamin D is believed to support the function of these glucose transporters, especially in muscle and fat tissues, which are major sites for glucose uptake. So by making it easier for glucose to enter cells, vitamin D can help lower the amount of sugar circulating in the bloodstream. This action contributes directly to better glycemic management and helps prevent that sustained high blood sugar that can lead to complications in diabetes. And finally, under this first point, let's talk about the health of pancreatic beta cells. These are the tiny factories in our pancreas that produce insulin, and their health is critical. Vitamin D is thought to support these important cells in several ways. For instance, it may help protect beta cells from damage. It could also play a role in ensuring they can produce and release insulin effectively when it's needed. Now, considering that beta cell function often declines in type 2 diabetes, any support vitamin D can offer in preserving their health and efficiency could translate into better natural insulin production. And that, of course, leads to more stable blood glucose levels for individuals managing the condition. Number 2, meta-analysis and large-scale studies. The strength of the data. Now, for our second key finding, which looks at meta-analyses and large-scale studies, essentially, the strength of the data. You know, when many individual studies point in the same direction, researchers often combine their results. This is called a meta-analysis, and it helps them get a clearer, more powerful picture. When it comes to vitamin D and diabetes, these kinds of large-scale analyses, some looking at up to 39 randomized controlled trials, have really strengthened the case for its benefits. These comprehensive reviews consistently show that vitamin D supplementation can lead to a significant reduction in fasting blood glucose levels for people with type 2 diabetes. And that's a key daily measure of how well blood sugar is being managed. And these powerful meta-analyses didn't just stop at fasting blood sugar. They also looked at hemoglobin A1c, or HbA1c, levels. As you may know, HbA1c gives a longer-term view of blood sugar control, reflecting average levels over about 2 to 3 months. The findings were encouraging here as well. Vitamin D supplementation was associated with noteworthy reductions in HbA1c. This suggests that the benefits of vitamin D aren't just a quick fix, but can contribute to more stable, long-term glycemic control, which is absolutely vital for preventing those serious diabetes complications. Furthermore, insulin resistance, that core problem in type 2 diabetes where the body's cells just don't respond well to insulin, was also examined in these extensive reviews. Using a measure called the Homeostatic Model Assessment for Insulin Resistance, or HOMA-IR, the meta-analyses found that vitamin D supplementation actually helped to improve insulin sensitivity and reduce insulin resistance. And tackling insulin resistance is truly fundamental to managing type 2 diabetes effectively, as it helps the body utilize glucose much more efficiently. Now, what's particularly interesting from these large studies is that the positive effects of vitamin D weren't the same for everyone. It seems certain groups benefited more. For instance, individuals who started the studies with a diagnosed vitamin D deficiency experienced more significant improvements in their blood sugar markers after taking supplements. This really underscores how important it is to identify and correct low vitamin D levels, as it might just unlock greater metabolic benefits. Another group that appeared to gain more from vitamin D supplementation was individuals with a higher body mass index, or BMI. Since obesity is often a companion to type 2 diabetes and is frequently linked with lower vitamin D levels and greater insulin resistance, this finding suggests that vitamin D could be an especially useful supportive strategy for heavier individuals who are struggling with their blood sugar control. And lastly, on this point, those who had higher HbA1c levels at the beginning of the studies, meaning their blood sugar control was poorer to start with, also showed more substantial positive changes with vitamin D supplementation. This indicates that vitamin D might offer a particularly helpful boost to individuals who are finding it more challenging to get their blood sugar down to target levels. It really provides an additional tool in their diabetes management toolkit. Number 3, factors influencing effectiveness: dosage, baseline vitamin D, and duration. All right, let's move to our third key finding, which deals with factors influencing effectiveness, specifically dosage, baseline vitamin D levels, and the duration of supplementation. The journey to really understanding vitamin D's role in diabetes care shows us that its effectiveness isn't a one-size-fits-all kind of thing. Several important factors come into play. The dosage of vitamin D supplemented, for instance, is a critical element. Research indicates that the specific amount of vitamin D taken can significantly influence how much improvement is seen in glucose metabolism and insulin sensitivity. This really highlights that getting the dose right is key. And alongside dosage, the duration of vitamin D supplementation also appears to be an influential factor in determining the outcomes. Some studies suggest that the length of time an individual takes vitamin D can impact how much their glycemic control improves. The optimal duration might vary based on the person's initial vitamin D status, the dosage used, and their overall health profile. This really makes personalized advice quite important. Perhaps one of the most significant things that determines vitamin D's effectiveness is an individual's baseline vitamin D level before they even start supplementation. It turns out that people who begin with clinically low or deficient levels of vitamin D tend to show a much more pronounced and positive response to supplementation when we look at their blood sugar markers. This is in comparison to those who already have adequate or sufficient levels to begin with. Now, there's evidence to suggest that higher doses of vitamin D supplementation may be more impactful in achieving those desired glycemic benefits, especially when the goal is to quickly correct an existing deficiency. However, and this is really crucial to remember, high dose should always be medically supervised. This is to avoid potential side effects and to ensure it's appropriate for the individual's specific health needs. Interestingly enough, Some research points to short-term supplementation, particularly at higher doses, as yielding more noticeable benefits in certain contexts. This might imply that an initial, more intensive period of building up vitamin D stores could be particularly effective for rapidly boosting those stores in deficient individuals. This could potentially kickstart improvements in their glucose control. It seems the positive impact of vitamin D supplementation on blood sugar really shines brightest among diabetic individuals who are also confirmed to be vitamin D deficient. So, addressing this specific nutrient shortfall appears to be a crucial step for vitamin D to exert its potential beneficial effects on glucose regulation and insulin action. Furthermore, individuals with diabetes who are also carrying extra weight or are classified as obese may find vitamin D supplementation particularly beneficial. This subgroup often deals with lower baseline vitamin D levels and more significant insulin resistance, making them potentially more responsive to the metabolic support that correcting their vitamin D status can offer. Number 4, contradictory evidence and study limitations. Okay, for our fourth point, it's important to look at contradictory evidence and study limitations. While a significant amount of research does support the benefits of vitamin D for glucose control, it's really important to present a balanced view. We need to acknowledge studies that have found different results. You see, not all research has concluded that vitamin D supplementation leads to improvements. For instance, some trials, particularly those that used high-dose vitamin D given intermittently, think a large dose once a week or once a month, did not find any significant positive changes in key glycemic markers like HbA1c or fasting blood sugar in patients with type 2 diabetes. This certainly highlights that the way vitamin D is given might really matter. These differing results across studies can often be traced back to variations in how the research was designed and conducted. Factors such as the specific form of vitamin D used, for example, D2 versus D3, which can have different potencies, or how vitamin D deficiency was defined by researchers, play a role. Also, the specific characteristics of the people included in the study, like their age or how long they've had diabetes, and the overall length of the study and its follow-up period can all contribute to the diverse outcomes we see in the scientific literature. The people participating in these studies also vary greatly, and this is a factor known as population heterogeneity. The effects of vitamin D might not be uniform across different ethnic groups or individuals with different genetic backgrounds. Similarly, those with other coexisting health conditions or people with vastly different dietary patterns and sun exposure habits might respond differently. This inherent diversity makes it challenging to apply findings universally to all individuals living with diabetes, suggesting that responses can be quite personal. And finally, on this point, it's also tricky to isolate the effects of vitamin D alone due to various confounding factors. For example, how well participants stick to their prescribed diabetes medications, or whether they make other positive lifestyle changes like improving their diet or increasing physical activity during the study, can influence results. Even their incidental sun exposure, which boosts natural vitamin D production, can affect a study's outcomes. These factors aren't always perfectly accounted for, potentially making the true impact of vitamin D supplementation a bit harder to pin down. Number 5, clinical recommendations and practical considerations. Moving to our fifth and final key finding, clinical recommendations and practical considerations. When we're considering vitamin D supplementation for diabetes management, it's always wise to look at what current expert bodies and clinical guidelines suggest. Generally, while vitamin D is undeniably essential for bone health and overall well-being, the routine recommendation of high-dose vitamin D supplements specifically for improving blood sugar control in all diabetic patients is not standard practice. This is especially true if there isn't an underlying deficiency. The primary focus firmly remains on established and proven diabetes management strategies, things like diet, exercise, and prescribed medications. This really underscores the critical importance of an individualized approach. Before anyone with diabetes considers starting vitamin D supplements, the very first step should always be a discussion with their healthcare provider. This will likely involve a blood test to accurately measure current vitamin D levels. This assessment is crucial to determine if a deficiency actually exists and if supplementation is genuinely needed. It's also vital for establishing a safe and effective dosage. Now, if vitamin D supplementation is recommended by a doctor, it should be viewed as a supportive or adjunctive therapy. What this means is that it's intended to work alongside, and not as a replacement for, the core treatments for diabetes. You can think of it as one potentially helpful piece of a much larger comprehensive puzzle. This puzzle includes healthy eating, regular physical activity, consistent medication adherence, and ongoing medical monitoring to effectively manage diabetes and maintain overall health. The biology of vitamin D and insulin resistance. Let's talk a bit more about the biology of vitamin D and insulin resistance. Vitamin D's influence extends far beyond just keeping our bones strong. In the context of diabetes, it's believed to support healthy blood sugar levels by potentially improving how our cells respond to insulin. This is partly by affecting insulin receptor expression, and also by aiding the function of those pancreatic beta cells that produce insulin. Interestingly, its role in calcium balance also indirectly links to how insulin is secreted and utilized. Risks and safety of vitamin D supplementation. Now, what about the risks and safety of vitamin D supplementation? Well, while vitamin D is generally very safe when taken in appropriate amounts, it is possible to take too much. Excessive intake, which can lead to vitamin D toxicity, can cause a buildup of calcium in the blood, a condition called hypercalcemia. This might result in symptoms like nausea, vomiting, weakness, and even kidney problems. Therefore, any supplementation, especially with higher doses, should always be under the guidance and supervision of a healthcare professional. So, to wrap things up with our conclusion, emerging scientific evidence strongly suggests that vitamin D can be a valuable supportive nutrient for improving glucose control in certain groups of individuals with diabetes. This is particularly true for those who are found to be deficient in this essential vitamin. However, it's absolutely crucial to understand that vitamin D is not a standalone cure or a primary treatment for diabetes. Instead, it's a potential adjunctive therapy, meaning it works alongside a comprehensive, professionally guided management plan. If you found this information helpful, we encourage you to share it with others who might be interested in diabetes management. And of course, we really encourage you to discuss your own vitamin D status and any potential supplementation with your healthcare provider. If you have questions or want to share your experiences, please feel free to do so in the comments section. And don't forget to subscribe for more updates on diabetes research.